All right, so I have my my tuning fork. Excuse me, sorry about that. We're gonna go ahead and do your rinse test, okay? I'm gonna basically make some noise, and I want you to tell me where you hear the sound the most. Whether it's on your right ear, your left ear, or you hear it equally on both sides.
I heard equally.
Equally, perfect. And okay, so the next test we're gonna complete is the Weber's test. I'm gonna go ahead and grab my phone to use a little bit timer, and we'll get started. Alright. So, I want you to tell me when you stop hearing the sound.
Okay. Can't hear it.
Do you hear it now?
Mm-hmm.
Can you tell me when you stop hearing it?
Can't hear it.
Perfect. So you were able to hear it about this equal to a little bit longer without the bone conduction, which is a normal finding. We're going to go ahead over to the other side and do the same thing. And again, tell me when you stop hearing it.
Can't hear it. Can't hear it.
Perfect. So you heard it the first time about 13 seconds, and you were able to hear it the second time about 15, which is a normal finding. All right, so the next thing we're gonna do is go ahead and inspect your nose. So we're gonna be looking inside your nose. I'm gonna be looking for any drainage, any redness, also any lumps, bumps, bruising as well. Can I just have you bend your head back a little bit? Thank you. No, your nose.
Oh.
Looks good. I see a little bit of redness on the in the nasal septum on the left side. Do you have any pain there?
No.
Do you have any issues with your nose, with nosebleeds or anything like that?
Yeah. History of nosebleeds.
Frequent nosebleeds?
Mm-hmm.
Okay.
I haven't had them recently, but.
Okay, looks like it might be a little bit dry or inflamed in there. Sometimes changing of seasons can do that, but also maybe just consider humidifier in your room.
Okay.
Okay? Alright. The next thing we're going to do is go ahead and look at the mouth and the throat. I'm looking again for any redness, any abnormals, rugae, and also taking a look at your tonsils. Can I have you open your mouth, please? And go ahead and stick your tongue out. Perfect. Good. And can you lift your tongue up for me? Good. And to the side. Good. So the tongue is pink. The buccal mucosa is moist and pink, which are all normal findings. It looks like all teeth are intact. Good. And I'm inspecting. Go ahead and say "aw" for me. Sorry about that. And the tonsils are about 2+, meaning they come about 1/4 of the way out. I don't see any redness or irritation, so all of these are normal signs. And I'd like you to go ahead and just kind of say a couple words for me. The cat is walking next to the dog.
The cat is walking next to the dog.
Can you open your mouth and say it again?
The cat is walking next to the dog.
Perfect. So what I'm looking for is to see that the tonsil lifts up when he talks, and it does, which is a normal finding. All right, so now I'm going to be taking a look at the neck. I see that the neck is symmetrical, the trachea is nice and midline. I'm going to be palpating some lymph nodes. All right. So right here I have the superficial cervical trunk lymph nodes, and over here I'm going to go a little bit deeper, and now I have the cervical trunk, the deep cervical trunk. Next I'm going to palpate the carotid arteries. Any pain or tenderness there?
Mm-mm.
And now I'm going to be taking a listen to them. Perfect. So I do hear a small bruit in the carotid artery, and that's an expected finding. Okay, the next thing we're going to be doing is testing your cranial nerve number 11, and this cranial nerve kind of runs right across here on your shoulders. What I'm going to do is I'm going to place my hands on your shoulders, and I want you to resist my hands. Perfect. So it has good shoulder strength, and I just want you to lean back just a little bit. Go, keep going, keep going. Perfect. I'm looking for any JVD. Go ahead. Jugular vein distension. And the jugular vein does not pop out, so he's negative for JVD, which is a normal and expected finding. And last but not least, for the neck, I'm going to be palpating the thyroid. Good. All right. So moving on to the chest. The thorax, I'm basically looking around the skin. The skin is intact. I don't see areas of redness or drying. No rashes are present. I don't see any lumps or bumps on the back side. Excuse me. I'm looking at your back. I don't see any bumps, any bruising. His skin is normal and intact. A little bit of just some acne, just a little bit, most likely from sports. So these are all normal and expected findings. The next thing I want to do is I'm just taking a look at his chest. I see that his chest expansion is normal. Go ahead and put your arms back down and just breathe regularly. Looking at him breathing when his chest rise is symmetrical, so these are all expected and normal findings. Respiratory rate is normal. He's unlabored. I don't see any retracting. And his AP diameter, looking from the side, is very symmetrical. We don't have any barrel chest, meaning the chest isn't popping out. These are all expected findings. Next thing I want to do is I'm just going to palpate for any fremitus. Good. Now go ahead and breathe in for me. Good. Next I'm going to do is what's called bronchophony. So I'm going to take a listen to your lungs, and I want you just to tell me that whisper the words 99. Excuse me.
99. Oh, I'm supposed to whisper.
Oh, you're good.
99. 99. 99.
Perfect. When he says 99, the words are muffled, which is an expected finding. Next, I want you to just say the word E.
E. E.
Perfect. Expected finding. It was when he says E, I hear the words E as opposed to ah. Next, we're going to do whispered pectorology, okay? I basically just want you to whisper the words that I'm saying. I want you to whisper 99, excuse me. Perfect. Also an abnormal, an expected finding. And now we're going to do percussion to look for any areas of fluid buildup. Go ahead and sit up for me. All areas are resonant to percussion. And now I'm going to go ahead and auscultate. I'm going to take a listen. Just go ahead and breathe in and out for me. Perfect. All areas of the lung fields are clear, and this is an expected finding. Now I'm going to do the same thing on your back, okay? So I kind of already had the opportunity to take a look at your backside. Again, the skin is normal, no rashes, no bumps, no bruising. All expected findings. I'm going to go ahead and do some percussion as well, again. Perfect. And next thing we're gonna do is we're gonna just palpate. I don't feel any areas of crepitus. Go ahead and breathe in for me. Good. Auscultation shows that he has very equal lung fields. Everything expands normal. We're gonna listen for in at least 8 different places, okay?
Okay.
Breathe in. All right. Next thing we're gonna do is we're gonna go ahead and take a listen to your different heart sounds. We're gonna check the aortic, pulmonic, herbs, tricuspid, and mitral valve of the heart. And we're gonna do it with both the diaphragm and the bell. All right. Good, the heart sounds are normal. I hear a normal S1 and S2. No adventitious sounds are present during auscultation. All right, and then I'm gonna actually have you lay down and we're gonna listen to your heart again and laying down on the bed.
Then you move to one side.
No, you're okay.